I have retrieved my CHG wipes from the warmer. The reason we store them in there is to reduce the stickiness on patient skin after application. Just a little something you can use to educate your patients on when they ask you why they feel so warm. Once the light is green in the warmer, it indicates good to go. So here we go, and we will demonstrate a proper CHG bath. Now that I have opened my wipes, we're going to begin with our CHG bath. So for your first wipe, we are going to focus around the neck, chest, and abdomen area, making sure to get in those folds on the neck. Rubbing our way down the chest. If your patient has a central line, like this lovely port, you want to clean around the device, as well as make sure that you go up your line at least 6 inches. Scrubbing it. Here we go, and then continuing down with the abdomen. There we go. Okay, and now with your second wipe, we are going to use one wipe for both arms. So you're going to start at the shoulder with your gentle rubbing motion, working your way down. Again, if your patient has a central or midline, hip line, you would wipe around the device and then continue down the tubing another 6 inches at least before you continue your way down the arm. Making sure to get the fingers, posterior arm as well. Continuing, across to the other side of your patient. Anterior. And make sure you get your armpits last. And with our third wipe, we're going to clean the genital surfaces. If our patient has an indwelling catheter, we're going to follow the same pattern we would with our central lines. So we would cleanse the area and then down the tube at least 6 inches away from the body. Continue with cleaning the groin after and your bilateral hips. Wipes 4 and 5 are both designated for the bilateral lower extremities. One wipe per extremity, differing from your arms just because legs tend to have a bigger surface area. So taking wipe 4, we would start right where we finished up around our hip, and we would use that, gentle brushing motion and work our way down the anterior leg and posterior as well, making sure to get behind the knees, in between the toes, disposing wipe 4, and repeating the same process on the other side with wipe 5. And with your sixth and final wipe, we are going to use it on the back side of our patient, starting at their posterior neck, working our way down their back, using that gentle rubbing motion to get their skin nice and clean, down to their buttocks as well. As we can see, there's a surface wound here, but there's no open mucous membrane, so we are free to scrub over that as well.